professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. Trying to make this video to try to orient this for students who might be, or researchers who might be looking for nice geospatial places to try to study chronic diseases. Now, part of research, part of understanding research is really, a lot of it is knowing where to get reliable information, trustworthy information that you know is valid. And so what I'm trying to teach you, of course, through any of these processes of searching through these data sets or databases, is evidence-based learning, is trying to find the types of information that you need to answer any sort of research question that may come your way. And having some sort of, if you've had some sort of clinical experience, it oftentimes helps to contextualize some of these scenarios in a more real way. Or even if you've taught, then in teaching, you're able to understand some of these social issues which keep occurring. Anyway, so here's some data sets that are available. Very, very quickly, there's actually 104 in this list. I doubt I'm going to be going over 104 of them. I have gone over other lists. Now, some of these might seem familiar. I might make some maps along the way. I'm not sure yet. As I'm talking. So the first one is places. This is a good one for local data for better health. So this goes into, and this is important, about 30 chronic diseases, 29 chronic diseases. And it's model-based estimates. I've used this. It's pretty good. Has some really important data on a lot of different chronic diseases. I said I wasn't going to click on it, but I did anyway. Population level analysis and community estimates. That's what this stands for. Robert Wood Johnson Foundation and CDC both came together to create the 500 Cities Project. So I encourage you to go check it out. I mean, there's a lot of good information. We're not just looking at, cardiovascular disease. Many people complain that's been over-researched. I'm not sure how, but some people say that diabetes and cardiovascular disease are ones that you see all the time. I don't think they're over-researched because there's still a lot of work to be done. But definitely cancer is also another one that's very important. We've seen trends that haven't increased, or hasn't decreased at least, in the last 30 years, and that's alarming. Actually, more has not, it's not really gone down. So, cancer needs a lot of work. But looking at, arthritis, asthma, chronic obstructive pulmonary disease, depression, obesity, all teeth lost, and stroke. So yeah, this goes into quite a few of these measures: physical health, mental health. So yeah, take a look. Next one that we want to be looking at, there's 104, so don't want to spend too much time on just one. I thought the Social Vulnerability Index was a really good one. There's 4 major themes, 15 social factors, Just quickly going through it, CDC, Geospatial Research Analysis and Services Program, GRASP, is a really good program by the ATSTR, which is actually used for an emergency response planning for public health officials, and really looks at some interesting, unique sort of indicators that you don't see in other data sets. For instance, lack of vehicle access, which is important in some places, crowded housing, which is interesting, and then four related themes of socioeconomic, housing composition, and disability, minority status, and language. Full SVI documentation is there, so I'm not really belaboring any of the points here, except for the fact that all of these exist, and just be aware of it. These are not just random data sets that I'm listing off. They're actually ones that you can do work with. So the only reason I'm only listing off them because that's the scope of this lecture. I did say I might make some maps if there seems to be some of these that are a little bit simpler to work with. But no promises yet. All right, so this is BRFSS, American Community Survey, combines the two and looks for questions like chronic obstructive pulmonary disease, emphysema, chronic bronchitis. These are very important. Of course, definitely heart disease, angina, coronary heart disease, heart attack, myocardial infarction, diabetes, chronic kidney disease. All of these are all there. And you could, at any point, open and map your classic. And I did say that I was going to make a map, at least one of them. So I guess I decided to go to make a map with this. So this is the selected chronic conditions by U.S. County 2018. And let's make sure and beautify it in the way that I like to, with adding the dark gray canvas. For some reason, that's the only one that I swear by. And then you can create your map and name it just the way you have been. And let's make sure we know that what the legend is saying. And so any condition prevalence, any of those chronic conditions I was telling you about, prevalence much more in the Appalachia regions. And so you could go in and actually explore each of these counties and see what the prevalence is of not only any condition, but also obesity, coronary heart disease, COPD, diabetes. And I can tell you the county health rankings don't have local level information on COPD, I don't believe. So this is a good place for that. So yeah, this is an additional place you can create a map. I've just created a map for you. If you want to save the map, of course, you have to take some additional steps here. You can just write save as and untitled map. This one's about selected chronic conditions, prevalence. You save the map and make sure that you take the extra step and actually share the map. And then all you do is you look at the URL that's been created and copy and save that. In fact, yeah, everyone has access. So all you have to do is now copy the URL, and then everyone will have access to this map. Whoever clicks on the link. So I don't want to get off task here too much, and continue on with the list of datasets that are available for geospatial analysis and chronic condition research. So again, social vulnerability, I already told you about 500 Cities Project, told you about selected chronic conditions, told you about that. Places can be used for arthritis. Some very good, insightful maps can be created from that. And then, of course, stroke from places. This is the places map, places dataset where a lot of these maps are being created from, basically. So you can just, instead of making your own map, you can kind of have these at your disposal. Getting places annual checkup, even. So as you can see, places is good for even health outcomes too. So just quickly taking a look at this map. And so a good thing about this is that it's actually already built, so you don't have to necessarily even do anything with this one, except for just zoom in to whatever location that you're looking for, and there's probably information about that. So Places is very interactive. Highly recommend that if you're researching chronic diseases, do take a stop at Places. This gives actually a little bit more information on Places, and what I like here is that it gives you measure definitions. Like for instance, what is a health outcome? So it gives you that, and then it also gives you social determinants of health and Places data. So this one is a really a good resource to be walking through, because this is doorways to additional data that you can have, which can provide more insights. So this is through, now I'm in the Agency for Healthcare Research and Quality, and this is now looking at a social determinants of health database beta version. And so this is actually visualizing SDOH data by county. And these are the types of maps that we need to be looking at to be doing robust social determinants of health work. This is what will tell us what we need to be doing at the local level for our students, or for if you're doing community level work for patients. These maps are very insightful. So this is looking at broadband, including cellular, computing device, and comparing a lot of these rates. So I've digressed quite a bit from the different websites, but let me go back to the starting point just so that we're not confused where we are. And then again, look at this list, come back to this list, and really take a look at, like annual checkup is really important. Take a look at some of these measures that might give us clues as to what types of chronic diseases are important. Places also gives information on health risk behaviors, so that might be good. Cancer, excluding skin cancer, binge drinking, heart disease hospitalizations, lack of health insurance, even sleeping less than 7 hours. So again, definitely a good place to be looking at, but maybe your better bet might be looking on the actual place's website directly, than going through the route of using ArcGIS. So I've given you about here about 40 or so maps, and so just from this, these interactive maps, you could get a lot of good information. Even take non-adherence, blood pressure medication non-adherence. Even this map can be, and if you look in the local county that you're trying to understand more about, and this is using the Atlas of Heart Disease and Stroke, then you can really use that map for to make some good conclusions about what is going on in the local area. And I've actually lectured on this interactive dashboard before as well. So they're kind of all coming together now because they're linked. One dashboard is linked to the other dashboard, so that is interesting. But if you want county level information, it's available for you here. And if you want to look at total cardiovascular disease deaths, all genders, apply filters. It gives you a robust instant map. So you can decide to choose to go through ArcGIS and access them through all of the various data sets, or you can choose to go to places and the NCCD here to work on these interactive dashboards. So there you have it. That's the combination of all the different types of information that you can get from these dashboards, and I hope this has given you some insights as to not only what types of things that you can work on, but where you can get insightful new prevalence data. Thank you for listening.